And we are right. Order. Good afternoon. This is the Health and Social Care Select Committee. Slight change to timing because there's a lot going on in the House of Commons today with a big statement from the Prime Minister downstairs. So thank you to our witnesses for being flexible and to those viewing slightly earlier than planned online. Today, it's Monday the 20th of May. We are in Committee Room 8 in the House of Commons. This is our third evidence session on our prevention inquiry workstream looking at preventing harm caused by alcohol, drugs, gambling and smoking. We've obviously talked a fair bit about smoking in this committee, and last week members of this committee were in Sweden talking about their smoking policies, and we were also talking about alcohol policy in Stockholm, which our guests are nodding, so I'm guessing they know a little bit about that world. So this session is going to focus on alcohol, so the current use of alcohol in England and the effects on health, of course, and strategies initiative aimed at preventing ill harm caused by drinking alcohol. And the broader inquiry is obviously looking at ill harm caused by smoking, drugs and gambling, as I said. This is the third evidence session of this particular work stream. As I said, when we did the last one, this was not the start, this was not the end, this was merely the start. This is the continuation. And here we are with another group of witnesses. Who knew? So let's introduce those witnesses. We have Sir Ian Gilmore. Nice to see you again, Sir Ian, who is Chair of Alcohol Health Alliance. Alice Wiseman, who's Vice President of the Association of Directors of Public Health and the Director of Public Health for Gateshead and Newcastle. And Ailsa Rutter, OBE, Director of Fresh and Balance. Ailsa, do you want to just tell those watching what Fresh and Balance does? Because it's not so obvious as it is the last two I introduced.
Thank you so much, and thank you for the honour of coming to the committee today. We really appreciate it. So Fresh and Balance, we're a regional tobacco and alcohol programme based in the northeast of England. The Fresh bit concentrates on tobacco, that launched in 2005, and Balance for alcohol launched in 2009, and it recognises the scale of harm of both tobacco and alcohol, and in fact, more latterly, really positioning alcohol much more closely to tobacco, knowing it's a Class 1 carcinogen. We're funded by our local authorities in the northeast, and we're working at population level.
Okay, brilliant. So you're partly funded by the lady sitting to your right.
Yes,
I
indeed.
suppose is the accurate way of looking at it. Okay, so this is the first session of today. We have a second session when we will be talking to the broadcaster Adrian Chiles, who many people will be listening. I hope you may get a chance to listen to a little bit of that. Let's start with you, Sir Ian, if I may. Obviously, we had a little bit to do with each other back in the day when I was doing the public health job in government. I just wanted to touch on, first of all, the 2020 Commission on Alcohol Harms. Obviously, that was somewhat overshadowed by the pandemic, and how do you reflect on that commission now? How well has it aged?
I think factually it's still an incredibly useful source. As you say, it was eclipsed at the time, but I think we learnt a lot of lessons from it. We learnt, for example, the importance of narrative in that report. There were some really harrowing experiences reported, and I think getting our messages over to the general public, I think statistics should not be the only way of doing it. I think we learnt a lot about the impact of alcohol in areas you wouldn't necessarily think of it first, like domestic violence, for example, like the fetal alcohol syndrome, homelessness. I think it's not really been superseded in any meaningful way. Clearly, we've now got the Scottish Government review of minimum unit price, which I think adds another dimension to it, but I think it's still a valuable source. And interestingly enough, the parliamentarians who were involved in it, and they were mainly parliamentarians, became so committed to it that the Commission continues, as it were. We're just thinking of the next little job for them to do.
Yeah, and if we look at ONS data published this month, in May 24, in 2022 there were the highest number of deaths from alcohol-specific causes in the UK. So, those figures don't lie. And I wonder, does this call for a renewed alcohol strategy? Does it?
Absolutely. We really think that it was 2012, the last strategy we had, and it was sadly watered down considerably, including minimum unit price being dropped out of it at the 11th hour. So we desperately do need a much clearer vision of where we want to go as a nation. I think clearly it's a difficult time politically with an election coming up, and we would see value in having an independent review, because if one was set up now, prior to the election, there might well be a really substantial piece of work with appropriate advice waiting for the next government.
Why do you think MUP was dropped at the last minute in England? I mean, by the time I was in the department in 2017, 18, 19, it was not popular, but obviously this argument goes way back.
I can't give you an evidence-based reason, but there's no doubt at all that the alcohol producers and retailers were not keen on it, and there was a lot of lobbying going on, I'm sure. Why David Cameron personally, because he did a U-turn on it, because he stood up and said sometimes in life it's important to do the right thing rather than the popular thing, specifically about MUP. And I was just reflecting that actually the Secretary of State for Health at that time was not at all keen on MUP, and the responsibility for alcohol was moved at the 11th hour from the Department of Health to the Home Office. It still sits with the Home Office, and I think maybe that's something that could be looked at by any review.
You think it should go back?
I think on balance, yes. I think it is a cross-government issue, and it affects the Treasury, it affects transport, crime and disorder, as well as health. There are so many departments, but I think if it's to have one home, I think we would see benefits in moving back to health and social care.
Interesting. Okay, thank you for that. Alice Wiseman, our own statistics, as in the government statistics, say that alcohol harm is especially prevalent in the most deprived local authority areas. Obviously, you have deprived boroughs and wards within your borough. I just wonder, what are your thoughts on how preventative measures, because that's what this inquiry is about, can be targeted in Gateshead, Newcastle, to tackle the issue?
Yeah, so we know that deaths from alcohol are 4 times greater in more disadvantaged communities, and actually what I think is even more compelling in terms of needing to tackle this is that there's an alcohol paradox, that those in the most disadvantaged areas don't necessarily consume above the levels of those in the most affluent communities, but yet they experience greater levels of harm. So, you're right. If you look at the data that was released earlier in the month, the rate across the UK is around 16.5 per 100,000, and in the North East it's 21, nearly 22 per 100,000, so significantly higher in the North East than it is in other parts of the country, and I have no doubt that is linked to increased levels of deprivation. There is the opportunity, I think, as Sirian's spoken around, about doing a comprehensive strategy. There's so much work we can do at a local authority level, and certainly the work that's been done with the Joint Combating Drugs Unit that has invested in treatment services has enabled us to provide, sort of treatment to those people who require it. But what we really need is population level action, and this requires action at a national level.
Okay, well, we'll come on to that in a minute, because James Morris is going to come up next. He's going to talk about population level. But let me just bring in Ailsa so that she gets to kick off as well. You are the only regional alcohol harms programme, and you're up in the North East. So does that not contradict Sirian's point about the need for a national alcohol strategy, because different areas are different? And that was the whole point, of course, of Health Devolution and Directors of Public Health. Discuss.
Yeah, so I absolutely believe firmly in the role of regional programmes, and I think it adds great value to the work that the local authority teams do and the really important work that our NHS trusts do as well. But I think what is the real missing link at the moment in comparison to tobacco is national action, national regulation. And I think that would greatly enhance the work that we do as a region. And, balance follows a very clear evidence base. We look very closely at what the WHO recommend. But I think one of the key things that we pride ourselves in is the over a decade's worth of experience around the right to know, and the fact that we're the only people that are actually delivering any kind of media campaigns. So, for example, most recently, alcohol is toxic. You know, through the leadership of our funders, we're able to do that, but it is understandably a drop in the ocean when we think about the David and Goliath, and we're up against multi-billion-pound advertising of the alcohol industry and this sense of promotion that, you know, alcohol is so endemic in society. But I think, you know, the impact that we can have would be much more greatly enhanced, if we had the level of regulation and the cross-party support that we've built up. You know, the collective leadership around tobacco in the last 20, 25 years is really why I'm here today, to say that if we're going to end smoking, which I believe everybody in the room wants to, we must have much more focus on alcohol as such, and the industries behave so similarly.
So you would concur with us putting them together in this piece of work, and it is no coincidence. Anyway, let's bring in James Morris and talk population.
Thanks, Joe. So Ian, I mean, to my knowledge, you probably know more than me, but over the last 25 years, there's been two main reviews of alcohol strategy in the UK. There was one done at the beginning of the noughties, I think, and both of them focused on a harm reduction strategy broadly. Has that had any traction in terms of improving the harms associated with alcohol?
I was involved with both of them, and I have to say that they both studiously avoided the big evidence-based policies around price, marketing, and they were just. You could argue they went for some low-hanging fruit, but I mean things like abolishing closing time, so that Londoners could have a glass of wine after the opera. Really, the unforeseen consequences of that sort of policy was frightening. So I think we have to go back to availability, price, and marketing, and so, neither of them really tackled those at all.
So on that basis, what is the evidence base around population level intervention from around the world or from other areas, that if we focus on the unit price, which I think we're going to come on to, and we focus on availability, what is the evidence base in terms of reducing all of the on effects around health, crime, and so on?
The evidence is overwhelming internationally, but you don't have to look any further than the Mediterranean countries like Italy, France, and Spain that used to be way above us in per capita consumption, and they've come right down over the last 20, 30 years, and we are overtaking them in terms of harm. Every country you look at, these are the key drivers. Now, there are other things that can be done. There are and the drinks industry will always say, no, it's a matter of, it's nothing to do with price or availability. We need to change the culture. But national policies can change culture. Because alcohol's become so much progressively cheaper in off-license outlets, that we've been turned into a nation that drinks mainly at home. So that culture has been driven by the cheap availability of supermarket drink.
And so you think that's where we still, in terms of targeted population intervention, it's in that area that you think
absolutely, and there's still the WHO best buys to reduce alcohol harm and prevention. So, and we're 100% behind those three. There are other things you can do. I mean, things that are simple, like putting alcohol in a particular area of a supermarket, so you have to make a conscious effort to go and get it, rather than having a special offer at the end of every aisle, as we've got in England. And Scotland have done that, for example. Ireland has done that. So there are other things that can be done, and it all helps. And we say repeatedly that minimum unit price is not a magic bullet on its own. It's one way of tackling price, and its benefit is that it preferentially targets the heavier drinkers, but it works in a complementary way with duty, for example.
Okay. Ailsa, do you see this move towards home consumption and the impact on that? And what's your view about what needs to be done?
Yes, we do indeed, and I think, the fact of the matter is it is just so cheap to be able to, for example, preload before you go out on a night out in a younger generation. But I think it just really strikes me now, and with a young daughter, is just going into that supermarket, the fact that on so many different aisles now, alcohol is in your face. It's the fact that even simple things like, as a society, Mother's Day, really difficult trying to find actually a gift for a mother or a card that doesn't have alcohol on the front of it, or, for example, Father's Day coming up. And these are all triggers. And I think it's also recognising, for us in the North East, we have around half of our adult population drinking at levels of increasing high risk. And if you are trying to cut down, I think we're hearing from a lot of people in the North East coming to us to say it's really hard to cut down if you're in recovery. There are so many triggers every which way you look that are almost screaming out to you that alcohol, have another drink, for example. So I think these measures are incredibly important, and things like we've done on tobacco, like, for example, putting cigarette packs out of sight, point of sale displays, etc., they're all important steps along the way in terms of reducing that kind of just social norm aspect. So yes, I would very much welcome what Sir Ian said.
And just quickly, Alice, governments have always, again, over the last period of time, have separated alcohol from drug strategy. Do you think there's an argument for the two being seen in the same sort of strategic light?
From an addiction perspective, obviously addiction cuts across both of those in terms of substances, but for alcohol you do need to have that broader approach which looks at population level prevention measures, and that makes it different. And sometimes what happens when you link it too closely to drugs, that actually you lose the focus that we could have on alcohol. I think that there are opportunities. We certainly wouldn't have people who were selling drugs, sat around the table in developing our policies. And, there is something about actually thinking about alcohol and alcohol producers in the same way.
Okay. Thank you,
Very good. Rachel Mascor next.
Thank you ever so much for joining us today. I want to start by just taking that broader look and particularly around policy, because that's what we want to do, is make some recommendations to government as well as obviously get the incoming government thinking. So in particular, I think looking at a common theme has been about advertising. So we've seen the stringent measures that government have brought in around tobacco. We've been looking at vaping as well, plain packaging, health warnings, getting rid of colours, descriptors. When we look at alcohol, increasingly it's following a pattern of targeting its marketing, particularly at younger people as well. How far should we go on looking at the whole advertising industry in regulating and indeed restraining kind of what it does? Perhaps if I can start with you, Sir Ian, and then move on to Alison.
It just typifies how alcohol is around us every day, and indeed it's a social inequalities issue. Those children brought up in poorer areas are exposed much more to billboards and advertising and outlets for alcohol than our children from better backgrounds. So we have to look at alcohol. It is part of driving the culture. The advertising really does make a difference. As you say, they focus it now towards young people, they focus it towards women. Rather like smoking, women have been gradually catching up with men, although the harm is still probably about twice as great in men than women. But I think we will, like MUP, tackling advertising is not a magic bullet, but at sports events it is just bombarded at individuals. In France there's a complete ban on broadcast advertising of alcohol, there's a complete ban on sports sponsorship, and we really need to look very hard at those international comparators.
Thank you. And Alice, if you could particularly kind of address the issue around the target audiences as well, and how far we should be going with advertising restraints?
Yeah, so I mean, I completely agree with Ian. Marketing normalises consumption and fosters those positive attitudes towards alcohol. Just on our way here from King's Cross, we walked through one of the tunnels on the tube, which is branded with Heineken linked to the women's football. And what it was telling women all the way through is if you want to be part of this, then you need to be drinking alcohol and drinking Heineken, particularly in this context. I would suggest you go and have a look at that tunnel because it was really quite mind-blowing as we got off the train. Alcohol appears in half of all TV broadcasts. We know that when we were looking at UK popular reality TV, 98% of them includes alcohol consumption. And we know that exposure to marketing leads children to drink earlier. And more than 80% of 11 to 19-year-olds can recall exposure in the past month. These are really stark figures that we've got. And we also know that there's more marketing in more disadvantaged areas. So picking up your earlier point around, inequalities, we know that this is normalised. And actually, we know there's lots of public support for restrictions on marketing. And if we look at the work that's been done on tobacco over the last 2 decades, you can correlate action in the adult world on young people and children smoking and prevalence of smoking early. So action in the adult world actually protects children and young people from harm. But we were looking at data that we've got recently from the North East, and there was a significant proportion of people who were interviewed through Balance who actually supported pre-watershed bans. So 70% of Brits support that, 77% support measures to protect kids. So I do think there is public support for this. I think if people have the opportunity to really make genuine choices without being influenced by marketing, then that would be something that really could be quite significant for us.
Thank you. Also, I want to move on to the issue of availability as well. Just returning from Sweden, we know that alcohol products can't just be bought anywhere, bought in specific places at specific times. So it does really restrict people's choices, but also people make a positive act to then go and purchase what they choose. It's not restrained in the quantum people can purchase. Would such a policy, do you believe, have an impact here? And secondly, I certainly know from visiting kind of corner shops in my constituency, many are now putting alcohol behind the shelf because they don't want people to steal it, basically. So it's for a different reason. But should we follow again what we've done with tobacco products and put them out of sight and out of mind?
Yes, I certainly believe that there is much more that we could do, and that there is really strong correlation between alcohol availability, the consumption, the harm. And the fact of the matter is as you're saying, Rachel, you can get it everywhere. I mean, even petrol stations, for example, now. I mean, it does seem really quite bizarre how freely available we've made alcohol. And we also know the availability of it also directly correlates with levels of crime as well. And in Scotland, neighbourhoods with the most alcohol outlets had crime rate over 4 times higher than neighbourhoods with the least as such. And we know also the hours of sale as well. So we've seen positive measures taken in Australia and Queensland, for example. And we know that, by bringing forward some of the alcohol licensing earlier, that has seen a significant drop in, say, crime from nightclubs opening later on, etc. But it does just seem at the moment that there is just a presumption to grant alcohol licences, and I'll defer to Ailsa in a second, but I know it's really hard to be able to say, hang on, we've got enough alcohol licences in our area because of some of the weaknesses really to the Alcohol Licensing Act. So certainly we believe as Balance it is just disproportionately available in too many places.
Did you want to come in then, Surin, if you wanted to just bring any further comment on that?
Yeah, so the Licensing Act is permissive. Obviously, when we're looking at granting a licence at a local authority level, you're looking at proving that there's going to be some level of harm, which is very difficult to do prospectively, especially as health isn't one of the criteria that we've got. I think the Licensing Act was designed to address the pub culture. And actually what we've seen is the harm is more about people who are drinking excessively and drinking at home and buying from supermarkets. What it doesn't allow us to do is to do that, because it's very difficult to tie an off-trade premises down to a problem that's happened in somebody's home several hours later. So there is something about having a look at that Licensing Act and potentially thinking about off and on trade differently. I think that there is lots of people who are talking about the importance of hospitality for various different reasons, but it doesn't have to be mutually exclusive in terms of availability of hospitality and tackling alcohol harm. If we were to look at off-trade sales, and we know that areas where there's higher levels of density have higher correlations in terms of hospital admissions and death. We know that children in the most deprived communities are 5 times more likely to have off-trade within their areas. So there is something about whether the Licensing Act could be, amended at a future point so that it looks at off and on-trade separately.
DPHs have a role as a formal consultee within the licensing process.
We already do have, so I'm a responsible authority, and what I do is we've got a way of looking at the premise where they're asking for it and looking at the harm, but what we currently have to do is tie it to the licensing objectives, which doesn't include harm. So whilst I present my licensing committee with health data, they can't take that into account when they make the final decision. I can tie it to things like protecting children from harm. And the example that Ailsa gave before about extending hours of sale has been one of the reasons why my local licensing committee in Gateshead has refused to sell to have a licence that sold alcohol from 8 in the morning, because we knew that the harm would be when children were coming home from school.
Strengthening that role could be quite important. So Ian, I don't know if you've got anything to say about availability.
As you may know, my background was a liver specialist, and my patients at the Royal Liverpool Hospital with severe alcohol-related harm, when they were well enough again to get their dressing gowns on, they would walk over the road to a corner shop and could buy alcohol. So I would just love to see public health and alcohol being allowed as a licensing objective.
Thank you.
All right. Paul Blomfield next.
Thanks very much. I do want to come to the issue of minimum unit pricing, but I wondered if I could just ask a couple of questions on advertising. Alice, you said that we should be concerned about home drinking rather than the hospitality sector, and I take your point and argument there, but are there areas of the hospitality sector that we should be particularly concerned about? Those parts which are encouraging high levels of consumption over short periods?
I think that there is something about promotions and thinking about those promotions that are encouraging harm, and certainly the bottomless brunches and that type of activity I think could be looked at. The thing you've got with hospitality is you've got some safeguards in place, because in theory you can revoke somebody's licence if they serve to somebody who's intoxicated. So actually, as a local authority, if we, with the right resources to be able to go in and manage some of those situations, you can actually take action on those individual premises that are acting irresponsibly. The issue that you've got is you can't take that same action in terms of the off-trade, because like I say, you could go into a shop and buy 10 bottles of wine and nobody would question what you're doing.
Okay, thank you. Ailsa, I wonder if I could ask a question about advertising in young people, because you touched on that. Intuitively, the case for the correlation between advertising and young people's behaviour seems unarguable. Mm-hmm. But there is some evidence that young people are drinking less. How do you square that?
So I think the jury's still out, really, actually, in terms of certain cohorts of young people are quite possibly drinking less, and I think a generation that are probably more health oriented, but that doesn't mean that there aren't still significance of young people that are drinking quite excessively, particularly when they're going off to university, etc. And I know myself just that quite inappropriate marketing that is happening to 18, 19-year-olds straight away, this norm around alcohol as such. I mean, I think there is thinking about the impact on the older generation as well. I mean, from the balanced perceptions and alcohol studies that we're doing in the North East, it's kind of our generation, actually. It's 45, 54-year-olds that are drinking really at quite significant increasing harm levels, and the impact that is then having on their family as well as such. But I think it is fair to say that the level of alcohol advertising and the lack really of any awareness raising, as I mentioned earlier, around Balance is the only place that is able to do the media campaigns, and the low level of awareness in the public that alcohol actually causes 7 types of cancers. And just recently in our Alcohol is Toxic campaign, we've had fantastic support from a breast cancer specialist nurse, Caroline Tweedy, who said the devastation of having to break the news to that woman she's got breast cancer, and the minimal awareness that 1 in 10 breast cancers sadly are caused by alcohol as such, and the right to know aspect. So when we think about advertising, I would also like to say there are some minimal things I think we should be doing, like mandatory labelling on the bottle itself. There is no information on those bottles, unlike the very clear information now we have on cigarettes as such. And the public, they want to know. The reception that we've had in the North East from our Alcohol is Toxic campaign has been phenomenally high, and they want the truth. And I think the role that we have is to tell people the truth as such.
Thank you very much indeed. So let me
if I could just come on that one point, I was reminded of the recent WHO report that British children were top of the league in 44 nations for drinking.
Younger age.
Yes, a third of 13-year-olds, half of 15-year-olds.
Shocking.
Sorry to interrupt.
No, not at all. I was about to ask you a question. But going to minimum unit pricing, the evidence seems to be fairly overwhelming. Public Health Scotland have said it's had a positive impact on health outcomes. There seemed to be a direct correlation in Wales when minimum unit pricing was introduced with sales falling. And yet the Permanent Secretary of the Department told the Public Accounts Committee last year that the results are currently unclear. How do you respond to that, Sir Ian?
Yes, I think they were unclear to him. I don't think they were. I think Alice, you were there then, and I think you were more clear. No, I think that the assessment of the policy changes in Scotland has been gold standard research, carefully peer reviewed, and has given a very, very clear answer. And it was interesting when they were debating the elevation of the price. There was cross-party support. All the parties, SNP, Conservatives, Labour, supported that. So I think we do have a very good example on our doorstep.
So what would you say to those who say one of the problems with minimum unit pricing is it might target heavy drinkers, but it's also, when we're talking about equality issues, it impacts hardest on those who have lowest incomes?
Well, that was a source of concern in the Scottish data, and one that the drinks industry jumped on with great alacrity. These were really people at the most severe end of alcohol dependence who were seeking access to treatment services. And what they need are proper treatment services, which are woefully inadequate, but I know that's not part of your brief here today. But I think that to me, means that certain groups need particular treatments, but it doesn't take away from the fact that alcohol targets the heavier end of the spectrum where the most benefit can be obtained. And, about 40% of alcohol is being drunk by people who are drinking well above recommended limits.
So you're absolutely clear on it. Minimum unit pricing is an important part of the...
It's an important part. It is not the only part, and it really complements duty very well. And I was looking at the data recently, and I remain impressed by the data, the way that when the Labour government of about 2008 brought in a 2% increase in duty ahead of inflation, we saw deaths plateau for the very first time.
Thanks very much. Alice, you look as if you're bursting to come in on the issue.
Well, just because I think that we need to learn from the story of tobacco. So minimum unit prices are really important, but it's important as part of a coherent strategy, and this is why we need kind of action at a national level. It also focuses on reducing the availability of really cheap, high-strength alcohol. So again, targets those sort of off-trade premises that are selling high-strength alcohol. And the other point I wanted to make was for those who are moderately drinking, it doesn't make a great deal of difference in terms of their financial impact. It is a targeted measure for those who are in the most disadvantaged groups. So the more lives were saved in the bottom 40% for deprivation. And it was actually that shifting of population level consumption. So a 3.5% reduction in sales in Scotland during the time of their evaluation, and that's at a population level. And it's all of these things that I think we need to kind of add together in the same way that we've had with our journey on tobacco, that will make a difference in terms of overall prevalence of harm at a population level. So it's a whole range of measures that are needed. And as Sirian said, from an addiction perspective and those who are dependent drinkers, you know, the work that we've been doing as part of the Joint Combatant Drugs Unit to make sure that we've got robust treatment services for those who require addiction support means that we're able to support those at the end. But actually, if we could stop people from getting there in the first place, I think that would be even more important. And minimum unit price has to be one of those tools, if you like, in our toolbox.
Thanks very much, Ailsa. I'd love to bring you in, but I think we're probably running out of time.
I think you think correctly. That's excellent. I just wonder, just finally, Ian, you know, we talked many times about these issues, and we were talking about, you know, the holiday bore that goes on about where they were last week, which was not a holiday, FYI. It was jolly hard work, and we found out it fascinating what's happening in Sweden and the way that they have complete state monopoly of sales, and they restrict behaviour by restricting availability. They admit that they could never start from here. They've had it since the 50s. Would we have a prayer of starting such a thing here?
I think I'd have to ask a politician that.
What a politician's answer, if I may say, but a good answer. But restricting.
It's fascinating that you found the visit so remarkable.
Well, I'm all for channeling my inner nanny state, and just trying to take on big health. How interventionist could we actually be? Because to really move the dial on smoking, we're having to be very interventionist to finish the job. In the words of the Khan report, how interventionist should we actually be?
Well, there's no doubt if one went straight to the Swedish system, there would be all sorts of nanny state arguments, and individual choice is being interfered with. But no one volunteers or chooses to become alcohol dependent, and it's such an awful disease. And if we're not talking about something that just affects a few people in society, there's hardly a family that hasn't been touched by alcohol harm in some way. And I think that's probably why we have been so surprised that the polls we've done have been so positively behind action. So maybe not replicating Sweden on day one, but I think it might be easier than we imagine.
Well, there's a positive note to end. Thank you very much for your time. That's Sirian Gilmore, Alice Wiseman and Ailsa Rutter. We will switch over to our second panel, and I will introduce as we do that. So thank you very much for your time. If you exit stage right, and you're very welcome to take a seat behind you and listen to the second half. Produce our report in due course, and I'm sure you'll be following that with great interest. Okay, so for the second half, if you like, of this session, we've got about half an hour or so to talk to Adrian Chiles, who will be well known to members and well known to people watching this web stream. Presenter of The One Show, Daybreak, chief presenter for football coverage on ITV Sport, Working Lunch, The Money Programme, Match of the Day 2, currently works with BBC Radio 5 Live. Adrian Chiles is just taking his seat now. Adrian, it's lovely to see you. Thank you so much for coming in.
Not at all.
We first met shortly after I'd left office as Public Health Minister, and I helped you with the documentary Drinkers Like Me, which aired on the BBC in February 2021. And you subsequently wrote your book, The Good Drinker, How I Learned to Love Drinking Less, which came out in October 22. And you very kindly gave me a copy, which I read with great interest. That's why I was so interested to hear you come before the committee. You say on the back of your book, it's a great quote, which is why it's on the back of the book, I guess. If I'd lined up all the drinks I'd drunk in a 40-year drinking career stretching back to my mid-teens, that line would be around 3 miles long. More shocking than that, though, was the figure I got to when I considered how many of those drinks I could have done without. Or put it another way, how many of those had I really enjoyed, wanted or needed? I reckoned it was no more than a third. What a waste. What led you to speak so publicly about your drinking journey, Adrian?
Well, in short, initially, I suppose, it was in desperation to get somebody to let me make a documentary about something. But I very quickly realised sort of I was onto something, because just asking myself some searching questions, thinking, well, I drink a lot, but I'm not this thing I thought of as that we all do have this image of the alcoholic. Yet, I was high functioning. I wasn't waking up in a skip or a shop doorway or fighting or doing anything bad. But on the other hand, how could I say I wasn't in some way dependent? If, I couldn't remember the last time I hadn't had a drink during the day. Not a massive amount to drink. I never got drunk. Never got ill, never misbehaved. Just drink something every day. And I just realised and there's absolutely a place for this, most coverage, most TV documentaries concern themselves with, the money shots, the blue lights, the kind of stuff which, and there's absolutely a place for that. And it's the kind of thing Ian deals with alcoholic liver disease and so on. But most problem drinkers don't fall into that category. But that doesn't mean they haven't got a problem. And actually, the single biggest reason that I became passionate about it, or started to learn more about it, was actually the first or the second day's filming. That was on a Sunday. On the Saturday, I'd been to see my football team, been to see West Brom, had a few pints in the pub beforehand, didn't drink anything that afternoon, got the train back to London, went to a 40th birthday, had maybe a couple of pints, some wine, some Prosecco or something at this 40th birthday party, then another couple of drinks later on when I really should have gone home to bed, but it was fine. It didn't feel like a heavy drinking day to me. But with the camera pointed at me for the first time in my life, I actually counted my units, and it was like 38 units in one day, and it didn't even feel like a big drinking day to me. I just thought, hang on, this is serious. I really am drinking a lot here. So, then as part of the programme, I went for a liver scan, and there was some suggestion of fatty tissues around it, and then my numbers didn't look good. I thought, right, well, as the hepatologist said to me, something's got to change here. So that focused my mind somewhat.
And I think your work has helped a lot of people focus their minds. And you talk, in focusing, no pun intended, that it's all put together. You talk about the font size on products. The smallest font size, I think is 0.8, as opposed to the 10 or 11 that is actually considered optimal for being legible. You talk about that in the Commission on Alcohol Harms that we were just talking to Serene about there. And you talk about, you didn't realise you needed reading glasses until you were actually trying to read silver on white on the back of a lager can. They put this on there because they have to, but who on earth could see it? And I wondered if you could expand on that. But also, I love the way you speak about nobody goes into a pub and says, I need to go to drinkaware.co.uk and I'll just check that before I carry on with the session. So therefore, how effective is all of that good work?
Well, I think, and even the sort of libertarians like Chris Snowden will agree with me on this, that he doesn't think we should legislate, doesn't think we should stop people drinking, but they should have complete information. And there's not complete information on there. And if it's so small you can barely see it, it's not complete. And if you've got it on a can or a bottle, we should say how many units are in there. Just, in big letters you can see. And it should be on a pump, if you're in a pub where the lager or the bitter or whatever is dispensed, it should say on there, not the alcohol content, 4.6% or whatever. You just said, look, in half a pint there's this many units. In a pint, there's twice that. And it should also say the calories on there. I mean, there's all sorts of anomalies. Now, this might have changed, but I don't think it has. That if you buy a bag of crisps to go with your pint of lager, it has to say how many calories are in the bag of crisps. But you don't have to put the calories, I don't think, on the amount of calories contained in an alcohol on a can of beer. Yeah. Interestingly, if it's non-alcoholic beer, you do.
Yeah. So what we are putting on there, we're saying you have to put some things on there, but they're on there so small that they're ineligible, and then there are things that are not on there that you're saying should be. No, really, really interesting, and thank you for speaking up the way you have. I'm just going to bring in some other members and give them a chance to speak to you. So, Paul Blomfield.
Thanks very much, Chair. I'm really interested to follow this through a little bit, because when I go into a shop to buy a sandwich, I always look at the traffic lights. And frankly, if there's a red traffic light, I buy the sandwich. Clearly, I'm not going through that same process when I go into a pub. Now, I guess that to some degree, providing that sort of information that you describe might lead people to choose one product more than another, because less strong alcohol is going to get not flagged to the same degree. But is that the reason that you're making the case, or is it because it's part of a widening awareness of the levels of units consumed?
Widening awareness, and if you see, the units expressed more widely, then more people would be clear what a unit is. And I know Steve is one of the people who'd say, nobody talks in terms of units, and I get that, but there's a lot of highly intelligent people I know who say, "Oh, units, what are they? It's so complicated." It's not that complicated. I know people who can split the atom who would still say, "Oh, I don't really understand units." I think the more they're out there, the more people will be familiar with it. But in a way, it's kind of not really sort of my area. The longer I went on with it, I realised it was about just changing. Certainly with me, and I think with others, and I get to speak to a lot of people. People will stop me in the street all the time and want to talk about drinking. It's about just changing the way you think about it. It is, and as Steve very kindly mentioned the line from the book, is that, I just thought I lined up all the drinks I've drunk in my life in 3 or 4 miles long. That's too much alcohol to put through your system. Undoubtedly. The tragedy for me is that if I ask myself how many of those drinks I really wanted or needed or enjoyed, it's only about a third. So if I say to people, look, if sometimes I'll say, and it's probably the wrong thing to say, look, if you're drinking, and I did say exactly this to a guy who said to me at a West Brom match, actually, just after the programme came out, he said, I drink 50 pints. I drink 50 pints of lager a week. He goes, "Do you think that's too much?" And absurdly, I started adopting the tone of the urbane modern doctor, going, "Well, you might consider, cutting it back." But what I actually said to him was, look, if you're loving the bones of every one of those 50 pints, then who am I to tell you not to drink them? But are you? Really, are you? And the answer you normally get is no. If it's like me, you're just drinking for the sake of drinking. And the other revelation, okay, more through writing the book, was, I realised that the first, the change of state is achieved by only the first drink. It's only the first drink that matters. And that gives you a change of state. For whatever reason, whatever's going on, you're slaking your addiction more than your thirst, but the first drink gives you a change of state. You feel maybe better about things. And the second drink, less so. The third drink, hardly at all. So if you drink and drink and drink, every drink you have is just a vain and hopeful and hopeless and doomed attempt to recreate the feeling that first drink gave you. And A, I believe that's true. B, it's really helped me thinking, do I want another one now? How much better is that third drink going to make me feel than the second drink? And I just think it's an important thing it's an important thought to hold on to. But as a therapist who I spoke to for the book said, who talked me through this actually, but rather sort of undermining her own argument, he said, yeah, but what about if you drink? What about if you drink for oblivion? Okay, what then? I said, well, if you're drinking for oblivion, that's something different, and I don't really know what you do about that, because moderation, though I came to love drinking less. Moderation will give you a lot of things, but it won't give you oblivion unless something goes very wrong. So that's probably something a bit different. I mean, the other big thought which I try and put into people's minds, I found myself more and more asking myself, why do people think they can drink? To some people, big drinkers think they can drink with impunity. Why don't they think the rules apply to them or the guidance applies to them? And it just became clear to me by asking a drinker, a big drinker like me, like I was anyway, just ask them a simple question: what percentage of all drinkers do you think are drinking 14 units or less a week? And the answer you will get usually is none, maybe 5%. Well, the answer, and this is contested because it's notoriously difficult to get the data, but the answer is 70%. And if you look at the margin of error, we can agree pretty safely it's more than half of all drinkers are drinking moderately. That's a big thing to bear in mind, because most drinkers will sit there in a bar and they'll say, well, everybody drinks all the time. Everybody drinks like me. It's that power of social norming. It's very powerful, compounded by the fact that most drinkers like me would surround themselves with other drinkers. Now, when I went to university, I came to London from the Midlands, and in the 4 years I was at university in London, let's say I made roughly 30 friends and acquaintances. By an absolutely astounding coincidence, every single one of them was a drinker. So I sought those people out. They sought me out. And then all my social life, to this day I'll meet them, then we meet for a drink. That's what we do. And we think everybody is like that, and that is the way to convince yourself that you are fine just to carry on drinking.
Interesting point about positive social norming, but I mean that's particularly true, or has traditionally been the point people go to university, as you described.
Yeah.
This is what you do. There were some American universities who did some work about positive social norming about most people don't drink.
Yeah.
And it actually had a surprisingly good
effect. I think that's really
interesting. Can I
interesting.
push you on another issue?
Yeah.
Because you've been in a unique position to kind of come to terms with your drinking. One of your answers in terms of what we need to do is better understanding of units, and with that, I guess, the consequences. What else do you think should be done to change behaviour? And what sort of interventions can government make in particular? And you've got a big background in sport.
Yeah.
And the association between sport and alcohol, particularly with young people. Do you have any thoughts in that area?
Well, I think, and it's not my field really in terms of messaging, nudge. I think it's called nudge, not nudge economics. Yeah, just nudging people into something. I think a better message would be along the lines of be like. Instead of do not drink, you must drink no more than 14 units a week. And I know that's not exactly what the wording is, but it should be more along the lines of be like the vast majority of drinkers. Drink moderately, 14 units or less a week. That would be a useful kind of tool. I think Sky Bet actually do something similar on the hoardings around. I'm no fan of the betting industry, but the hoardings around football grounds. I think I'm right in saying, I've seen an advert saying, be like most of our gamblers and bet responsibly.
It's a subliminal way of encouraging
betting.
Yeah,
which is, and I think...
But let me just say, and that's an important point, because it's a subliminal way of encouraging betting.
Yeah.
What about taking the kind of association with sport and drinking away altogether in terms of advertising and sponsorship?
Well, I don't know if you do. Yes, I mean, I think I probably would do that, but then where do you stop? You know, you take gambling away, then most of the money going into football sort of disappears as far as I can see. But yes, that in the end, I just don't think the toothpaste's going to go back in the tube on that one. I think we sort of stuck with it. And look, maybe there's a way of tackling it, but for me, it's more about, I don't know, changing just changing the mindset. I mean, I think a lot about the term alcoholism, and I've almost given up sort of railing against it. But it just strikes me as there's so much. You're looking at people who want to tackle their drinking, know they drink too much, because there's this idea of alcohol, extremely heavy addiction we know as alcoholism, because we call it an ism. Then we don't call it, you're not a heroinaholic if you're a heroin addict. You're not a smokeaholic if you're a heavy smoker. But we call alcohol, we call it an ism, and there is some evidence that it is a disease. I'm not, won't necessarily get into that. I personally doubt it, but there you go. I think it's just much more helpful to look at it as, if you drink alcohol at all, you're taking an addictive drug. And if you just drink 14, 20 units a week, you're a little bit addicted. You drink 50 units or 100 units like I was some weeks, you're very addicted. And you drink north of 100 units a week, you are dangerously addicted. You are on that spectrum. One of the issues with having it as an ism is that an awful lot of time is wasted by people. And I've heard this, been asked this a million times, like, so what do you think? Am I an alcoholic? Do I have this ism? Do I have this disease? Now, that came from a good place, taking the blame and the shame away from people, saying it's a disease, and I get that. But there's so much time wasted on trying to work out whether you've got that ism or not. And that holds people back, because connected with the idea that it's an ism is this idea that the only way you can tackle it is to just stop completely. There is no other way of dealing with this. Okay. Excessive consumption or the ism. Okay. And I just think that really does put people off. That frightens people off from dealing with it. Now, for some drinkers, don't get me wrong, it is absolutely appropriate way to give up completely for several months or a year or forever. I get that. But there is another way. And people get hung up on the 14 units. Well, if you're drinking 56 units a week, the truth is you're going to struggle anytime soon to get down to 14 units a week. But that's not to say you shouldn't try. And as I understand it, the way the harm curve works, if you get down from 50 to 30, you're actually relatively doing yourself more good than going from 30 to 10. If you see what I mean, because the harm curve steepens.
Yeah, thanks very much.
Thank you. The big day here, Adrian. As you're broadcasting head on, you recognise time is not on our side, so we're going to try. We've got to try and finish about 5:10 today, so to get down for the Prime Minister for what I'm sure you'll be talking about on your programme, like everyone is on broadcasting today. So Rachel Mascore's got a question, then James has got a question. Yeah.
Thank you, Chair. Really interesting what you've had to say there, and I think there's two models, isn't there? There's abstinence and harm reduction, and you're very much in that harm reduction space. I think the big question we're looking at is how do you get people to stop and think, what am I buying for? So it's the kind of just buying a bottle of wine on your way home every night, and then you go at home and you drink that bottle. That kind of, how do you change those behaviours? From your own experiences, what do you think those big interventions are? They messages? Is it about public health, as we've heard? Is it about the amount of money you're spending? What are the kind of interventions that you think could say, before I actually buy that bottle of wine again or have a couple of pints?
Well, I think in terms of the information on there, there's the money, the price of it, the calories sort of therein, perhaps. But again, doing a job on yourself, I think the following morning is really important, thinking, hang on, how much of that did I really enjoy? That whole bottle of wine, you know, just it's sort of nudging people towards that sense. Also, you know, it really did take me a long time to realise that less is more. The less you drink, the more you enjoy it. You know, so, you know, it might sound obvious, but you sort of drumming that in is, you know, I think is important. But also telling people, you know, you can drink less, and if you don't get down to 14 units, look, getting from 50 to 25 would be great. 50 to 30 would be great. You know, marginal gains are available here. I mean, actually, just one thing I think is really important, which is I've never got to grips with what the truth is on this, but a number of people say to me, we've got an issue. I said, we're going to see your doctor. I said, oh, I don't want it. I said, why not? And it's because I don't want it on my medical records. And I said, well, I mean, that's confidential, but actually, I mean, in a way, is it? I mean, I say mothers, if they've got a big problem, might say they'd be worried about getting their children taken off them or something unnecessarily. But, I mean, as I understand it, life insurance can go to your GP and ask for your medical record. I'm asking you the question now. But I think they then have to divulge what's in your medical records.
It's a big debate here.
I mean, okay. So look, I'm sure you've thought about this, but you know, that's a real tragedy if that's in people's minds. You know, I've told enough people, "Oh, don't be silly, just go and see your doctor." I thought, well, hang on, how silly were they being?
Yeah, that's a good point. A very good point.
Okay.
Yeah, James.
Move on for time.
Yeah, let's bring in James.
Adrian, yeah, I mean, we obviously have a culture of drinking in this country. I mean, there was, 20 odd years ago, the licensing laws got deregulated, and the people who advocated for it painted this vision that the culture of our drinking would change to a kind of more Mediterranean way, and we'd all, be sitting outside drinking wine and eating rather than going to the pub, drinking and fighting. I mean, that was the broad caricature. Do you think we're anywhere near that?
No, I don't. But then sort of post-lockdown, very often you find pubs are closing before 11 o'clock. So it used to be all the talk we live in a 24/7 lifestyle, but, you can't get breakfast in some places before 8 o'clock, and you can't get a drink after sort of 10 o'clock, So I'm not sure that's quite happened. I think you began your question by saying, we've got this big drinking culture in this country. I'm always careful about saying that because, yes, it's true. On the other hand, you can get into a social norming type thing when you're saying, well, everybody drinks. It's part of life.
Yeah.
But, as I've said, 70% or more than half of all drinkers do drink moderately. Mm-hmm. Right. Also, pubs and bars are a big part of our culture. But only half the population, look, that's a lot, but only half the population ever see the inside of a pub or a bar at the same time. So, look, I'm not saying there's not an issue, which there clearly is, but I'm just wary about saying it's a bit like the fella standing at the bar says 14 units are nonsense, everybody drinks more than that. I'm just wary about.
You still, I mean, if you go into centre of Birmingham, centre of Manchester, whatever, on a Friday or Saturday night, you can still see.
I mean, look.
I mean, the consequences of vertical drinking or whatever are apparent.
Yeah.
Have we got any chance of changing that culture over time, do you think, or what would we need to do? Is it a question?
As I understand it, millennials or Generation Zs or whatever we call them now, in their early 20s and so on, are drinking. I mean, the data tells us they are drinking less, which makes me hopeful that things are slightly changing. I mean, the advertising, just on changing perception as well, it struck me just two kinds of adverts you might see about alcohol. The one is everybody having an absolutely fantastic time, dancing around with Campari or whatever, alcohol, the key to a good time. And then you might see the health danger adverts, which might be somebody's had a terrible accident, blood pouring out their head, hospital bed, God knows what else, which goes to the extreme. You know, if I won the lottery, I would get an ad campaign going out, and it would be drinking is boring. Drinking's mainly it's boring. It makes you boring, and it becomes boring if you do too much of it. Now, I thought about doing a picture book of you know, a book of photos or a newspaper article about shots of people drinking boringly. Now, unsurprisingly, I couldn't find any takers for this idea. But it's a way of communicating that, just how dreary, just how dreary it is.
Yeah. Thank you, Joe. Well done, James. Right, the model of brevity, Paul Bristow.
Thanks very much indeed. I mean, I hear what you're saying about social norms, and I completely understand what you've said, but I would just be interested to know your views on to what extent do you think problem drinking is associated with pubs or drinking at home? At least with pubs and social drinking, there is a moderating factor, perhaps, in your friends and family and those you drink with, and then obviously a landlord who would, in theory, would not want to serve someone who's drinking too much. Whereas at home, which is much, and also the other factor, of course, is expense. It's much more expensive in pubs and in bars. Whereas at home, people drinking at home, especially since lockdown, isn't that where we should focus, perhaps?
It is, but it depends what kind of drinker you are in the first place. The picture seemed to me mixed during lockdown. Some people were drinking a lot more because they were drinking at home. Others, and I was one of them. I drank even less then because I realised there's a social component to it. You know, look, I'm not beyond polishing off a bottle of wine. Don't get me wrong, but generally, while I'm at home, it's not what it was about for me. But yes, I think both have got to be both different kind of modes of drinking. I think both have got to be tackled. You're quite right.
As to the point you've made already, I think the battle is being won amongst, also here, amongst Generation Zs, and not least because it's not just about money. I also think it's a focus on their own fitness and wanting to be fit and wanting to do other things.
Yeah.
So isn't the challenge, and you said drinking's boring, okay?
Yeah.
I completely understand that. Isn't the real boring element of drinking people drinking at home because they're lonely, they're sad, they don't have strong relationships? As MPs, we see people probably at the bottom of their experiences. And the one thing that unites those people that I see who are having a difficult time a lot of the time is a lack of strong personal relationships and a lack of sense of purpose.
Yeah.
I think that's what leads people into
I think people in that situation, I mean, there's all manner of mental health issues, and I think excessive alcohol consumption would be a cause, and effect there. Yeah. So yes, you're quite right.
Adrian, thank you so much. You've been spot on, and brevity is much appreciated, and you've got across some really good messages. There's some great quotes in there that I think might end up on our report as well, especially drinking is boring, which I like that. Good luck with your new campaign.
Thank you very much.
When and if you are successful in the lottery. But listen, we will produce our report around this and produce recommendations to ministers as part of this prevention inquiry, and I hope you'll take an interest in that when that happens. I really appreciate your time today. That's the end of the session. Order.
Thank you very much.
8. Sound.
The proceeding has ended. 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 The proceeding has ended.